and in this video we'll be talking about something called as fat transfer, where we use your own body's mass to remove from one place and put it into another. You have excess fat in your abdomen or excess fat in your thighs, and this is the area that you're going to collect the fat from. The areas where fat grafting can be done are buttocks, breasts, face, and any other small area. Say post liposuction, there's a little bit of a divot, or post some major surgery, there's some other issue, we can use this fat. This is a technique that, depending on what needs to be done, we get patients asking us, Doc, why don't you remove fat from our tummy and put it into a breast, or put it into a buttocks, or put it into a face instead of fillers? I mean, is that even possible? Well, the answer is yes. And this is something that we do a lot. Hi, I'm Dr. Saumil Shah. I'm the Director of Plastic Surgery at Skin Zone Aesthetics in Borivali West. And in this video, we'll be talking about something called as fat transfer, where we use your own body's mass to remove from one place and put it into another. Now, we have decided that we are going to sort of augment a particular area of your body using your own fat. Great. We have also decided that you have excess fat in your abdomen or excess fat in your thighs, and this is the area that we are going to collect the fat from. So how do we do it? We do it by liposuction. Yes, the same liposuction that we use to remove fat. It's the same way where we remove fat. However, here one criteria or one thing that is different from just simple liposuction is that we collect this fat in sterile containers. If we have to do a lot of fat grafting, like say in breasts or in buttocks, we have special containers in which we collect this fat, we filter this fat, let the fat sort of clean it from the blood and from all the other fluid that might be there, remove all the excess oil, and then we put in pure fat into our patients. This is a technique that, depending on what needs to be done, will change whether we sort of require a lot of fat or not. If say we are putting on into someone's face and we don't require a lot of fat, we might even just use syringes and small cannulate to take this fat out, so that because on the face we can use that little amount of fat to do the tweaks that we want, similar to what we do for fillers. So as I already said, the areas where fat grafting can be done are buttocks, breasts, face, and any other small area. Say post liposuction, there's a little bit of a divot, or post some major surgery, there's some other issue, we can use this fat. Fat also has a lot of stem cells in them, and there's something called as nanofat, where we break down all the fat and just use the stem cells. This is used a lot for even hair rejuvenation, for facial rejuvenation. Sometimes also in cancer patients who have undergone radiation, we can use these stem cells, and they really help as well to sort of soften the areas. So there's a big use of fat cells when they are intact, and also fat when it's broken down and just has sort of nanofat, and we can also manufacture what is called as SVF associated with it. You can check out our video on SVF. These are the things that we can do with fat grafting, where we harvest the fat and sort of change it to the area that needs to be sort of where we need to put the fat. That is basically what the fat grafting is. Now, fat, once it's taken up into a particular area, so initially when we put fat into any area, you're going to have a bit of swelling, which sort of goes down by 2 to 3 weeks. So that would be the first thing that you would see, a little bit of volume loss. Second, up to 3 months, the fat can sort of, or the body can absorb the fat that we put in. This fat has to get blood supply from your own body to survive. If there is excess fat, that fat does not survive and is absorbed back into your body. As a result of this, around 30% of the fat usually goes away, and you will see that decrease in size with time up to 3 months after your surgery. When this happens, it's important to know that it can be done again, but this is something that your surgeon would have usually taken into consideration. So yes, fat does go away. However, what stays after 3 months stays for life. This fat also behaves like the fat from the area that we have taken the fat. So if you put on weight, this fat is going to increase in size. If you reduce weight, this will also reduce in size. So it's important that you are someone who keeps your weight stable, otherwise these things might change. So that's some information about fat grafting that a lot of people are opting for these days instead of something like implants. This can be done only for few patients. It's not always for all patients, especially depending on what your needs are from the aesthetic point of view. If you need to know more about this, do contact us and let us know, and we'll be ready to help.